The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. Welcome to the E2P Diabetes Tool, your comprehensive companion for diabetes screening and management within TELUS PSS EMR. Join us as we navigate through its features and functionalities. The Diabetes Management Tool supports the early identification of patients at risk of developing diabetes, creation of tailored care plans, review and assess of glycemic targets, and provides patient education and coaching resources, and promotes patient involvement and self-management. With the focus on providing access to evidence and standards, users can expect information related to best practice and clinical decision support embedded throughout the tool. Here we will demonstrate E2P tools based on two different scenarios. Patient 1 is newly diagnosed and the tool has not been used with this patient previously. For a patient who does not have pre-diabetes or diabetes in their problem list, the toolbar will inform you when the last screening form was last completed. Clicking on the diabetes button will trigger the screening and diagnosis window to open. For this workflow, users can write to the problem list by updating the diagnosis status as well as set the screening frequency flag. This window includes a link to the Canadian Diabetes Risk Assessment Questionnaire that can be completed to determine risk level and recommended screening frequency. Some of our users often delegate this action to the nurses supporting the visit. Once completed, the score can be entered. To support the screening and diagnosis workflow, the tool also includes the risk factors summary for the users to review and complete. This window will pull the matching risk factors found in the patient profile and allow users to manually add additional risk factors the patient exhibits. Next, the tool will pull in the patient's most recent lab results, graph them, as well as include the diagnosis cutoff point values for a quick reminder. The values will flag red if it exceeds the diagnostic cutoff to act as a quick visual cue for the user. These diagnostics cutoff values can be modified to the user's discretion using the gear icon. The tool also features access to the screening and diagnosis algorithm for quick reference when reviewing labs as well. Additionally, we have developed a dynamic lab requisition form to accompany the diabetes tool. In the top right corner, we have options for the user to select based on what they would like to order, whether that be for an initial investigation or ongoing management. Selecting the diabetes quarterly management would trigger the form to auto-select the labs pertinent for the respective option. Users will always have the ability to manually remove or select additional tests. Our second patient scenario is a patient who has been diagnosed with type 2 diabetes for a number of years. Once a diagnosis has been established, clicking on the toolbar will open the visit form. This form has been designed to be comprehensive but also flexible, allowing users the autonomy to fill out the sections that are relevant, understanding that other sections can be filled out further down the line. As you explore the E2P Diabetes tool, you'll notice the patient dashboard remains visible, providing quick access to essential patient information. Users have the flexibility to either view the full visit tool for a comprehensive overview or select specific sections to focus on during the patient visit. Let's delve into the four main sections or modules of the tool. In the assessment module, clinicians can review and document the patient's vitals, document the reason for today's visit, how the patient feels, and record symptoms using the pre-built stamp-embedded template. The Complications Monitoring module allows clinicians to track and monitor specific complications and comorbidities associated with diabetes, ensuring proactive management. The Complications Monitoring module allows clinicians to track and monitor specific complications and comorbidities associated with diabetes, ensuring proactive management. Empowering patients with tools and resources for self-care, the Lifestyle and Self-Management module provides guidance on diet, exercise, and other lifestyle modifications. Users can also update the smoking status in this section. In the Medications module, clinicians can document medication adherence, response, and use the medication reference table to make informed decisions about diabetes medications. In addition to the immunizations housed in this section, we have also allotted space to document information related to cardiovascular protection. Users can record and track whether the patient has been prescribed any of the following drugs. After recording any changes to the medications, users can prescribe the medications directly from within the tool using the drop-down feature shown here. At the end of the visit, users will click on the Generate Summary Note/Complete Form button to close the form. By doing this, whether a few sections or all of them were completed, the tool will generate a summary note, pulling in all the information documented in the tool and copy it into the Patient's Notes section of the EMR for users to review. Users will also always be able to review the original form by clicking on the Click to Expand button, which will trigger the whole tool to be visible. The Resources and Patient Care Plan is a consolidated form that houses a library of resources and tools for all of the conditions in the E2P tool repository. The goal is to support shared decision-making, patient education, and the creation of comprehensive care plans that can be printed for the patient to take with them. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice at cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offer guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on insulin therapy for type 2 diabetes and non-insulin therapy for type 2 diabetes. With E2P, clinicians can provide enhanced care for their patients, all while reducing their own workload and stress. Try our diabetes management tool today, and remember, our team is here to help. Learn more or sign up at e2p.ca today.